Remember when you were younger and everything just worked effortlessly? When your body responded exactly how you wanted it to, with power and consistency? Here's the truth nobody talks about, that strength doesn't have to disappear just because you've hit your 40s or 50s. Today, I'm showing you exactly how to bring back that forceful finish you thought was gone for good. I'm Dr. Olivia Brooks, and I've spent over a decade helping men reclaim their vitality and confidence. This channel is dedicated to giving you real, actionable medical strategies that actually work. And before we dive in, let me be clear. What I'm about to share with you is based on solid urological science, not wishful thinking. You're going to walk away from this video with a complete understanding of what's happening in your body and exactly what to do about it starting today. Now, I know what brought you here. Maybe you've noticed your ejaculation has become weaker over time. Maybe the volume has decreased, or maybe it just dribbles out instead of projecting like it used to. You're not alone in this. In fact, nearly half of all men over 50 experience some form of ejaculatory change, and most never talk about it because they think it's just an inevitable part of aging. But here's the empowering truth. It's not inevitable, and you can absolutely do something about it. Before we go any further, do me a favor. Hit that like button and subscribe to this channel so you never miss critical health information that could change your life. And drop a comment below telling me where you're watching from. I love connecting with viewers from around the world, and your engagement helps more men find this life-changing content. Let's get right into it. I'm going to explain what's actually happening inside your body, why these changes occur, and then give you 7 concrete steps you can implement immediately. No fluff, no sales pitch, just pure medical guidance that gets results. And trust me, you'll want to stick around until the end because step 7 is the game changer most men never think about. First, let's talk about what healthy ejaculation actually looks like. Your ejaculate should be whitish to gray in color, with a thick, viscous consistency. It should have a mild scent, but nothing overpowering or fishy. Think of the consistency as similar to mucus, not watery like skim milk. When semen becomes too watery or excessively thick, it's your body's way of telling you something needs attention. Watery semen usually means you're either dehydrated, not getting enough essential nutrients, ejaculating too frequently without recovery time, or potentially dealing with an underlying health issue like a prostate problem or infection. Now here's what most men don't understand. Ejaculation isn't just one simple action. It's actually a sophisticated 3-phase process that requires multiple body systems to work in perfect coordination. Let me break this down in a way that makes sense. Phase 1 is called the emission phase. This is where semen enters your urethra through a pathway called the ejaculatory duct, which runs directly through your prostate gland. At the exact same moment, your bladder neck automatically closes off. This is crucial because it prevents urine and semen from mixing and also stops semen from traveling backward into your bladder. Your body has this perfectly designed system to keep everything flowing in the right direction. Phase 2 is the expulsion phase, and this is where the magic happens. Your semen gets propelled outward using force from several key muscle groups. The bulbocavernosus muscle wraps around the base of your penis like a sling. Your entire pelvic floor muscle network contracts in coordination. And here's the critical part most men don't know about. The elasticity of your prostate itself acts like the elastic band in a slingshot. That elasticity is what gives you that powerful projection you remember from your younger years. But here's where things start to change as you age. Your prostate naturally increases in size over time. This is called benign prostatic hyperplasia, or BPH for short. As the prostate enlarges, it starts to lose that elastic quality. Instead of flexible, responsive tissue, your prostate begins depositing thick, fibrous collagen. Imagine replacing a rubber band with a stiff piece of cardboard. That slingshot effect gets replaced by a weak, ineffective push. And the statistics are sobering. Studies show that nearly 46% of men between 50 and 80 who have enlarged prostates experience either reduced ejaculate volume or absence of ejaculate entirely. Think of your ejaculatory pathway like a highway on-ramp. The ejaculatory duct is the on-ramp, and it merges into the prostatic urethra, which is the main highway. When your prostate is healthy and normal-sized, traffic flows smoothly at high speed. But when the prostate enlarges, or if there's inflammation or obstruction present, It's like a partial road closure. Everything slows down dramatically. The ejaculate either crawls along slowly or gets completely blocked. Your urethra can also develop what we call strictures. These are essentially kinks or narrowings in the tube that semen travels through. When a stricture exists anywhere along that pathway, your ejaculate will dribble or ooze instead of projecting with force. It's the difference between water flowing freely through a garden hose versus water trying to squeeze through a hose that's been stepped on. Now I want to address something important before we move forward. Many men feel embarrassed or ashamed about these changes, but there's absolutely no reason to feel that way. Your body is responding to natural physiological changes, medication side effects, lifestyle factors, or a combination of these elements. The fact that you're here watching this video means you're taking control of your health, and that's something to be proud of. Let's move into the solution phase. I'm going to give you 7 specific, actionable steps that address the root causes of weak ejaculation. These aren't quick fixes or gimmicks. These are medically sound interventions that target the actual mechanisms we just discussed. If you follow these consistently, you will see measurable improvements. Step 1. Review your medications with your doctor. This is absolutely critical, and it's often the most overlooked factor. Certain blood pressure medications, especially calcium channel blockers like amlodipine, can directly interfere with ejaculatory function. Alpha blockers such as doxazosin or tamsulosin, which are commonly prescribed for enlarged prostate, can also disrupt normal ejaculation. Antidepressants are notorious for this, particularly selective serotonin reuptake inhibitors like fluoxetine and serotonin norepinephrine reuptake inhibitors like duloxetine. Even some anticholinergic medications used for various conditions can affect ejaculatory strength. Schedule an appointment with your physician and ask if there are alternative medications that might be less likely to impact your performance. Don't just stop taking prescribed medications on your own, but do have this important conversation. Step 2. Transform your hydration habits. This might sound too simple to be effective, but dehydration has a direct and immediate impact on semen consistency and volume. Your body is approximately 60% water, and your semen production requires adequate hydration to function optimally. When you're dehydrated, your body conserves water for essential functions, and semen production gets shortchanged. The result is thicker, more viscous semen that's harder to expel with force, or conversely, watery semen that lacks volume. Here's your action plan. Drink at least 8 to 10 glasses of water daily. Cut back significantly on alcohol consumption because alcohol is a powerful diuretic that rapidly dehydrates your entire system. That's exactly why hangovers feel so terrible. If you're a regular drinker, even just moderate drinking, you're sabotaging your ejaculatory strength without realizing it. Step 3. Optimize your zinc intake. Zinc is absolutely essential for prostate health and semen production. It's one of the most concentrated minerals in your prostate gland, and deficiency directly correlates with reduced semen volume and quality. The great news is that you can easily increase your zinc intake through diet. Oysters are famously high in zinc. Pumpkin seeds, cashews, eggs, and red meat are all excellent sources. If you prefer supplementation, zinc can significantly boost both semen volume and quality. But here's the critical caveat. Never take zinc supplements without copper. Zinc and copper compete for absorption in your body. If you take high doses of zinc without copper, you'll deplete your copper stores, which can lead to anemia, weakened connective tissue, and immune system problems. Look for supplements that include both minerals in proper ratios. Or better yet, get your zinc from whole food sources where the balance occurs naturally. Step 4. Strengthen your pelvic floor muscles. This is where you can make dramatic improvements through consistent exercise. Remember that bulbocavernosus muscle I mentioned earlier? It wraps around the base of your penis and sits on top of an intricate network of pelvic floor muscles. These muscles must contract forcefully to propel ejaculate outward. If they're weak or deconditioned, you simply won't have the strength to produce a powerful ejaculation. Here's how to strengthen them effectively. When you're urinating, try to stop the flow midstream. The muscles you engage to do that are your pelvic floor muscles. Now practice contracting those same muscles when you're not urinating. Contract and hold for 5 seconds, then release for 5 seconds. Perform 10 to 15 repetitions 3 times daily. You can do this anywhere, anytime. Nobody can tell you're doing it. Within just a few weeks, you'll notice significantly improved muscle tone, and that will directly translate to stronger ejaculatory force. Step 5. Consider natural prostate support through specific botanical compounds. There's a plant extract called Pygeum africanum, derived from the African cherry tree, that has demonstrated clinical effectiveness in improving urinary symptoms and flow in men with enlarged prostates. Now, you might wonder what urinary flow has to do with ejaculation. Here's the connection. Both urine and semen flow through the same tube, your urethra. Anything that improves flow in one direction improves flow in the other direction. Pygeum works by reducing inflammation in the prostate tissue and supporting healthy prostate size. Other beneficial botanicals include saw palmetto, which supports urinary tract health, and green tea extract, which provides powerful antioxidant protection for prostate tissue. These aren't magic bullets, but they're evidence-based interventions that can support your overall prostate health when used consistently over time. Step 6. Explore prostate massage with medical guidance. Now, this isn't for everyone, and you absolutely must discuss this with your healthcare provider first. But here's the concept. Prostate massage can help clear out stagnant fluids, improve circulation to the prostate tissue, and potentially enhance the gland's contractile function. Think of it like massage for any other muscle or tissue in your body. It promotes blood flow, reduces congestion, and can improve function. Historically, physicians performed prostate massage in clinical settings as a therapeutic intervention. While it's less common today, some men do find benefit from it. The critical warning here is this: if you have any suspicion of prostate cancer, do not perform prostate massage under any circumstances. It could potentially cause cancer cells to spread. Always get medical clearance first. Step 7. Give your body adequate recovery time between ejaculations. This might surprise you, but it's potentially the most powerful intervention on this entire list. Your body requires time to produce quality, voluminous semen. When you ejaculate daily or multiple times per day, you're essentially draining your reserves faster than they can be replenished. The result is watery, low-volume ejaculate with minimal force. Here's what I want you to try. Implement steps 1 through 6 consistently for 3 weeks. During those 3 weeks, I also want you to abstain from ejaculation for 2 full weeks. You can still engage in intimacy, you can still enjoy physical connection, but hold back from reaching climax. On day 14, let it happen. I'm willing to bet you'll be absolutely amazed at the volume and force you experience. Then come back to this video and leave a comment about your results. I genuinely want to hear from you because I know you're going to see dramatic improvements. Let me recap everything so you have a clear action plan. First, review your medications with your doctor and explore alternatives that might have fewer side effects. Second, dramatically increase your water intake and reduce alcohol consumption. Third, ensure adequate zinc intake through diet or properly balanced supplementation. Fourth, begin daily pelvic floor muscle exercises to strengthen the muscles responsible for ejaculatory force. Fifth, consider botanical prostate support like Pygeum africanum. Sixth, discuss prostate massage with your healthcare provider. And seventh, give your body adequate recovery time between ejaculations. Here's what I want you to understand on a deeper level. These changes in your body aren't signs of failure or decline that you just have to accept. They're signals that your body needs specific support. When you provide that support through the strategies I've outlined, your body responds. You're not fighting against your biology, you're working with it, optimizing it, and empowering it to function at its best, regardless of your age. One more critical point. If you implement these steps and still don't see improvement after several weeks, or if you notice any concerning symptoms like blood in your semen, pain during ejaculation, or complete absence of ejaculate, schedule an appointment with a urologist immediately. These could indicate underlying conditions that require professional medical evaluation. Don't ignore warning signs, but also don't panic. Most of these issues are highly treatable when addressed properly. The men who see the best results from these interventions are those who approach them systematically and consistently. You're not going to see transformation overnight, but if you commit to this process for 30 to 60 days, you'll notice significant improvements. Your ejaculate will become thicker and more voluminous. The force will increase noticeably, and just as importantly, You'll feel more confident and empowered in your intimate life. Remember, every single one of these steps addresses a specific physiological mechanism we discussed earlier. You're not just throwing random solutions at the wall hoping something sticks. You're targeting the actual root causes: medication effects, hydration status, nutritional deficiencies, muscle weakness, prostate health, and recovery time. This is comprehensive, multifaceted intervention based on urological science. I also want to address the emotional component of this issue because it's just as important as the physical aspects. Many men experience anxiety, frustration, or loss of confidence when they notice these changes. Those feelings are completely valid, but they can also create a negative feedback loop. Anxiety and stress actually worsen ejaculatory function through various physiological pathways. When you feel stressed, your body releases cortisol and adrenaline, which can interfere with the relaxation and coordination required for optimal ejaculation. So as you implement these physical interventions, also work on reducing performance anxiety. Trust the process, be patient with yourself, and recognize that improvement takes time. One of my patients, I'll call him Michael to protect his privacy, came to me frustrated and discouraged. He was 54 years old and had noticed significant changes in his ejaculatory function over the previous 2 years. He felt like his masculine vitality was slipping away, and it was affecting his confidence in all areas of his life. We went through these exact steps together. We reviewed his medications and made one adjustment. He committed to hydration and zinc supplementation. He began pelvic floor exercises daily, and he implemented the recovery period strategy. Within 6 weeks, he reported dramatic improvements. But more than the physical changes, what struck me most was his renewed confidence and optimism. He felt like he had agency over his health again. That's what I want for you. Before we wrap up, I want to emphasize one more time. This is educational content designed to empower you with knowledge and actionable strategies. This information is not a substitute for personalized medical care. Every man's situation is unique, and what works optimally for one person might need modification for another. Use this video as a starting point for understanding your body and having informed conversations with your healthcare providers. If you found this video valuable, please hit that like button. It genuinely helps more men discover this content. Subscribe to Urology Education and Vitality so you never miss critical health information. And share this video with any friend or family member who might benefit from it. You could genuinely change someone's life by passing this information along. Drop a comment below and let me know which of these 7 steps you're going to start with. Are you going to review your medications? Focus on hydration? Begin pelvic floor exercises? I read every comment and I love engaging with this community. Your questions and feedback help me create even better content for you. Here's my final message to you. The changes you're experiencing don't define you, and they don't limit you. With the right knowledge and consistent action, you can absolutely reclaim the vitality and performance you remember. You're not powerless. You're informed, you're empowered, and you're taking action. That puts you ahead of the vast majority of men who simply accept these changes as inevitable. Take care of yourselves, gentlemen. Implement these strategies. Be patient with the process, and trust that your body will respond when you give it what it needs. I'm Dr. Olivia Brooks, and I'll see you in the next video where we'll continue exploring how you can optimize your health and vitality at any age. Disclaimer: this video is for educational purposes only and is not intended as medical advice. Always consult with your healthcare provider before making changes to your health regimen or starting new treatments. Individual results may vary.